She is assistant professor at Case Western Reserve University School of Medicine. During the COVID pandemic, she's been leading a team of healthcare subject matter experts who help employers sensibly return employees and customers to the workplace. Her team of physicians, nurses, industrial safety experts, and project managers collaborate to project and support business strategy through these unprecedented times. Dr. Zoltansky holds a Master's of Business Administration from the Weatherhead School of Business, Case Western Reserve University. She earned her doctorate in medicine at Case Western Reserve University School of Medicine. So basically we have two homegrown, hometown people that have been extremely successful in the medical community in Cleveland, Ohio, and the one stint into Arkansas as well. So if you guys would like to take it away.
Sure, and I probably could start off. Andy, are you going to run the slides? I can't hear you.
Sorry, I was on mute. Heather, is it possible to record this session as well? Or
yep,
whoever's running that? Yep, we got a thumbs up. Great, perfect. Sure. Okay, I will go ahead and share the presentation here.
Heather, also with us today is Jameson Collier, who's the UH System Chemical Safety Officer. He has a background in occupational and environmental health and safety, and he works in the Department of Environmental Health and Safety at UH Cleveland Medical Center. Jameson has been integral to the development of all the information that you're going to see today.
Great, thank you so much.
Next slide. And so today we're gonna give you, obviously the introductions are complete, a HUJA update, and then the Healthy Start playbook overview. This is where Dr. Zoltansky and Jameson will talk to you about the Healthy Restart playbook overview, workplace considerations, and also the Healthy Restart service offerings and the Healthy Restart playbook for reopening schools, which is a very interesting document. And when I was listening to some of the conversations earlier, I know it's at the top of many of the members of the Chamber's minds. So we go to the next slide, please. And then this is us. Next slide, please. So this is, I want to start off just by talking about AHUJA 2, because there's a lot of questions and interest in AHUJA 2. What you see here in the gray is the current hospital, the way it's configured, the tower, the Risman Pavilion. We will be building the two blue boxes there. The first one will be a new pavilion that will include a brand new emergency department, much larger, 8 new operating rooms, and Mother Baby. We will be bringing Mother Baby to Beechwood, very large. Obviously, we're a world-renowned program and a very large organization there to provide those services in the community. In addition, we will be bringing a new breast health service that will actually be relocated from the Minoff Center, which is across 271 in Beechwood. We'll consolidate it there. The breast health center will be adjacent to the ED on the first floor. And then in the sports medicine pavilion, we will have men's health, urologic health, along with orthopedic sports medicine. And in that facility, there will be a 60-yard synthetic turf field that will have 3 stories high above it, so that we could actually rehab athletes from grade school to professional. In addition, there are hard services there also for dance, basketball, tennis, running, you name it. So on that first floor, there will be a large rehab facility. In addition, there will be an MRI center right there located in that area. So it's a very large development that will begin, it actually is beginning this week, with some enabling projects. You'll see some construction right off of Richmond Road for a new parking lot that we're developing, along with an extension of a parking lot in the Risman facility, along with some enabling projects for utility service to the site. Probably in about November, beginning of November, you will see the area that in the blue and the parking around it cordoned off for construction. We'll begin that construction then for the pavilion, and it will probably go to the second quarter of 2023 to open. The Sports Medicine Pavilion will open, will start construction a little bit later into the spring, but will be done probably about a year ahead of the new pavilion. The pavilion being hospital grade and the sports medicine building being medical office grade. They're much different construction processes. So we probably will have sports medicine up a year in advance of the new pavilion. Next slide, please. I want to show you some pictures, conceptuals. Now these are conceptuals. It says draft on it, but it shows you currently where the current tower is and the areas that are to the right of it. There's the pavilion along with the new sports medicine building. So it gives you some perspective in terms of how large this development is. And one of the things I will tell you about the pavilion is the pavilion will be able to add 2 more floors, up to 52 beds in that building. So we have growth built into our inpatient units on inside Ahuja. Next slide, please. This is a view from 271. So you see in the foreground here, right in the middle, you'll see that's the pavilion area that will be built. And to the left of that, that's the sports medicine building. Next slide, please. And then this, as you come in off of Harvard Road, this is the building for the sports medicine pavilion. So as you can see, there's a 3-story area there that will be for rehabilitation that we're very proud of, that we've really worked very closly with our orthopedic surgeons and rehabilitation professionals to build something that really is a signature point of UH Ahuja. And so as you drive into the facility from Harvard Road, you will see this building first. Next slide, please. And then this area here is just past the sports medicine pavilion, the sports medicine building. And there you could see right in the middle there, that is the new pavilion. And it will be connected to Ahuja 1 by a series of walkways, both on the first floor and on the second floor. Next slide, please. So one of the things that I did want to talk to you this morning, in addition to just giving you a short preview of Ahuja 2, is welcoming back our community. And really one of the things that we have, as we've gone through, many of us have been home, working from home. Some of us are still working from home. A lot of folks at UH and in corporate functions are still at home. But many of our hospitals were at full go, really anticipating a much larger surge than what we got. But we did treat some very sick patients. We treated at UH Ahuja over 400 inpatients so far. And we on a daily basis, we average between 5 and 10 patients with COVID or that are COVID positive per day. And most of the patients that we're treating now are not on the intensive care unit. We're learning how to treat these patients much more efficiently through new drug therapies and processes. So we're getting better at treating it. Obviously, it's a very contagious disease. So we are very careful in terms of where we place these patients and how we handle these patients when they are infectious. So one of the things that we did when Governor DeWine really opened us back up in the beginning of the month of June, we realized that there were certain things that we needed to make sure that we really handled in a first-class way so that we can reopen and sustain that opening, because we are really a vital resource to the community. And part of what we want to do is we want to remain open, because during the end of March, beginning of April, and through April and the beginning of May, we were really essentially shut down to only emergent procedures. So it really took a toll in terms of our scheduling and bringing patients back that may be sick. Wanted to make sure that these patients receive treatment. A lot of folks delay treatment. We're seeing some of those patients now worried about progression of disease. So us staying open is a really important thing. And so what we're doing about that is we're ensuring social distancing. So we've restructured our waiting rooms for social distancing. We're lucky because this is only a 10-year-old facility, and it really is built very spaciously. We also have a cadence for appointments using technology. So a lot of our patients actually are waiting in the parking lot to come in. So we are trying to make sure that as we bring patients in, they are brought in an expeditious but a safe way. For cleaning and disinfecting public areas and patient care areas, we've also subcontracted with a third party to do our public areas because we wanted to move many of our experienced caregivers to the floors to take care of patients. That's not to say that our main public areas are any less of importance to us, but when you look at what we're trying to do, we have added a lot of folks who are cleaning the facility, making sure that it's disinfected, making sure that it's orderly. UH Ahuja was always a very clean new facility, but now we're really concentrating on disinfecting and making sure areas are clean in terms of the pandemic. The next point is screening and masking all building entrance. When you come into our facility, you will notice that you will get your temperature taken, you'll be asked some questions, you'll be given some hand sanitizer, and if you don't have a mask, we'll provide you one. It's masking and hand hygiene is incredibly important, as is social distancing. So we work very hard to make sure not only our patients and our visitors and our physicians are safe, but also our caregivers, because we've had some caregivers contract the disease. We don't think that many have contracted it from work, only just a few. What we're seeing is very few, because we have very good training around hygiene that have actually been positive. I think to date, through the whole pandemic, there's been 30 caregivers out of 1,000 people that have contracted COVID-19. And I think right now we only have 2 in quarantine, and they're coming out in the next week. So we may not have anybody out, which is a first through the pandemic, which is a really good sign. Next is testing for patients, making sure that every admission is tested, that procedural patients are tested before they come in, making sure that if someone does have COVID, we're putting them on the right unit if they're being admitted. If they're procedural patients, making sure that they're cleared of the disease before we perform a procedure on them. Now, we are able to do procedures up to surgery on COVID patients that are admitted. We have the facilities to do that. The issue is really making sure that anybody that is in elective procedure is clear of the disease before we actually go and perform a procedure on them. And then finally, we've welcomed back visitors. And it was a very lonely place there for a couple of months. But what's happened is that we have welcomed back visitors, 1 per day, to the inpatient units, 1 for ancillary services, and also 1 visitor for anyone undergoing a procedure. This is usually the same visitor all day long. You can't really hand off. Now, in end-of-life situations and serious situations, we do bend a little bit on that procedure. We obviously want to have empathy for our patients and families. But overall, what we're doing is we're trying to make sure that people are safe. So by bringing in 1 visitor, we're able to keep track, make sure that that person is the person that we're bringing in, and making sure we remain safe. A lot of the things that we've done in the past couple of months have been unorthodox to the community, but I can tell you they've kept us safe because we really are doing a very good job of keeping our caregivers safe and our patients safe. And then finally, yesterday, we were able to welcome back visitors to our emergency department. We have taken a longer time to really bring back visitors to our emergency department because we were trying to be very careful about this and make sure we had systems in place that really worked well, not only for the patients and the patient's family, but also for the caregiver. So really it's about safety. In that situation, we are allowing visitors to come back. Now, if a patient is test positive for COVID, no visitors. We don't have visitors for COVID patients at all, either in the ED or in the patient care units. We are using technology such as iPads, Zoom, Jabber, and some other things to communicate between families and patients. But until they're cleared, we really do limit the number of patients in contact with those with COVID-19. So the good news is we've welcomed back visitors. We've got really good social distancing going on, cleaning and disinfecting and screening, masking. But overall, the testing for patients allows us to keep the doors open to make sure that we're treating patients in the most expeditious and safe way. I'd be glad to answer any questions about Ahuja 2 or about our welcoming patients back to the community. Okay. With that,
I have one quick question.
Okay.
It's probably pretty easy. The parking that's there now, which I think is probably the orthopedic building.
You
is
mean
the
Richmond?
No, I apologize for the new part,
Yes.
the new orthopedic.
Yes.
What is the parking situation? Because I think that's a whole parking lot it's taking out.
Yes.
So is the parking situation up, down, net, even? Just because I'm curious.
Yeah, at the end of the project, we will have probably about 1,700 spaces. Right now, we have about 1,000.
Oh, wow. Okay.
So we are going to be taking up 450 spaces, and we will be adding back about 250. We have, in that lot that we're building off of between Auburn Road and Richmond Road, we have a small wetland there, and we have to mitigate that. We'll hopefully mitigate that by the end of the year, and then we'll build another parking lot, another extension of parking lot there, and it will replace the 450 spaces that we lost. We will also be building a 350 space lot at the corner of Richmond and Harvard. So the number is going up pretty significantly. In the interim, through this winter, we will have offsite parking for some caregivers if we need it. Right now, when we look at our parking is not as bad as what it was pre-COVID. We have anywhere from 100 to 200 spaces open any one day. We did this parking survey 2 weeks ago. And while we're looking at people being offsite, probably the people that will be offsite are students and vendors. And obviously the construction workers will be offsite too. So we think we will be able to manage the parking pretty well, but we will have some offsite parking for folks that are really not day-to-day employees of the hospital or patients. What we're trying to do is make sure we have enough spaces really for our patients, and that's what we're worried about in our visitors. Since the visitors are down pretty significantly, that's created a lot of opportunities for us during this time. Had we not had the issue with the wetlands on the north side of the building, we would have built out that parking lot and we would have been basically even. But you're going to see about 700 more spaces that we will be building for Ahuja 2.
How many new jobs does the new area add?
The estimates are about 1,000, but those are not, that's not FTEs, those are total people. So FTE wise, it's probably going to be 600 to 700 people, full-time equivalents. And they're spread over, 3 shifts, 7 days a week. So we know that we will have more people working there, but chances are they'll be working all sorts of different shifts. So we don't think that the parking is going to get affected that substantially. And we've done parking studies in terms of shift once we are at full force. And that won't happen for anywhere from 2 to 3 years from now, 4 years from now.
Thank you.
Thank you. Any other questions? All right. Dr. Zotansky, you have the floor.
Thank you. Jameson and I will just touch on some of the highlights of how we've been working with some businesses to support safety as they're going back to work. So we've been working on this in the UH system, a number of us. And what we really tried to do was take what we do in our own organization around best safety practices. Of course, there's no guarantee, there's no perfect solution, as anybody who's watching the COVID epidemic knows, but really just some solutions to try to support the safety as we move forward. But taking what we've been doing in our system around cleaning, masking, physical distancing, those types of things, and sharing with the community what we know. Next slide, please. The group of people that have been involved in this, and many more, Jameson included in them, are our infectious disease doctors, our pathologists who are experts in testing and have the latest, most up-to-date information in testing, which is a big ask from businesses to understand testing. And the availability of testing. Do people need tests before they come back to work? All of those types of questions. And also right now, a hot topic is pooled testing, those types of things. And then also our operators in our system who oversee the business side of things about making projections around the curve of COVID, if you will, in later in the year, so we can make a model for business and business projections. Next slide, please, Andy. Can you advance one, Andy? Thanks. And so we've been really, the ask from us, for us from the business community was around the business community wanted to know about keeping their people safe, their employees, their customers, keeping their workplace safe, their facilities. Alan was talking earlier about cleaning the facilities for COVID, those types of things. So we're sharing our expertise in that with the community around cleaning for COVID. And then also building trust with your employees and your customers. Next slide, please. We have on our website, if you look at the bottom there, it's uhhospitals.org/restart. Some materials that we've published for use by the community, by business leaders. So there's some graphics there that you can print out. There's posters for use, if you like, to remind your employees about the importance of wearing a mask, how to wear a mask, take on a mask, take off a mask. And so, of course, we talk a lot about masking. That's a hot topic. And about the importance of wearing masks for source control, so that if I feel sick, or if I'm not feeling sick, but I still may have COVID, that the importance of wearing masks to protect others. So even if you don't feel sick, as you know, it's possible to have COVID and spread it to others. And when we wear the mask, it helps us slow the spread in the community, even if we're not feeling sick. Next slide, please. And these are really the fundamentals, if you will, for business. We have a different way of remembering this, a different phrase that we've come up with for schools, but we came up with this one and it really resonates in our system and it stood the test of time, which is not easy to do in COVID. But there is a mask you see in each of these graphics. And so the basics are really masking, screening, cleaning, and 6 feet in between is the phrase that we use: screen, clean, and 6 feet in between. So the masking, which we talked about, the screening of employees before they come into facilities. So how are you doing your health checks that are in much of the guidance by the governor? How are you doing health checks, temperature checks, the symptom check, the cleaning, the disinfectants, those types of things that Jameson will talk about. And then how are you setting up your facilities for physical distancing? So not just enforcing it, but removing furniture, removing tables to set up a culture of physical distancing in your business. Next slide, please. And so these are some of the common workplace considerations, and Jameson and I will tag team this, but he could start and go through some of the things that we've been talking to businesses about, and I'll add in as we go. Jameson, are you?
Hey, sorry, was on mute.
Okay.
Good morning,
Thanks.
everybody. So our focus on disinfection is, one of our focuses is the common work areas. So, and that's looking at patient space as well as office space. Office space, we're doing things like staggering work schedules if we're able to in common offices or shared office spaces. Where you can't stagger those, we're looking at physical barriers, so plexiglass, things like that. And the eating areas, we're making sure that we're keeping at least 6 feet apart. That's one of the areas that we generally like to be more than 6 feet apart if we can, because they're high-risk areas. You know, people are in these areas mask off and eating. which again is a high risk activity. Some of the other common areas or public areas that we have, we're focusing on limiting capacity. So areas like restrooms, where we are taking sinks and stalls out of order to make sure that we keep at least 6 feet of separation, but also to keep people from congregating in those areas and limiting capacity to those areas, hanging signage, things like that. Our environmental controls, a few different things we're looking at is, first of all, making sure that you're bringing in as much fresh air as possible. So rooms that have HVAC systems, air conditioning, heating, as much as you can open those up to bring in outside air and get air change instead of air circulation is what we primarily recommend. Those areas where that's not possible, either there aren't windows or there's not effective ventilation in the space, there's options like portable HEPA filters and making sure that you have the correct CFU on those in comparison to the room size. So there may be some areas where you could put more than one in larger spaces where there's not a good amount of airflow. And then also on your buildings with environmental controls, making sure that you have the minimum recommended filter for the HVAC systems. So the CDC recommends a minimum of a MER 13 filter. And then also with those filters and your existing systems, making sure that that filter fits into the slot properly, making sure there's no gaps in that space so that you get adequate filtration. Regular cleaning is one of the most important and effective things that we can encourage. A lot of places have gone from one time a day cleaning where there's low populations to having multiple shifts of cleaning as much as possible. Creating a high touch surface list. So thinking about surfaces that you don't normally, maybe not normally think about when you're disinfecting. So light switches, doorknobs, and it varies by location, but creating a high touch list for your cleaning staff so that they have that visual to look at and to think of while they're cleaning. Deep cleaning. So making sure that you have adequate disinfectants. All of your disinfectants should be on your surface disinfectants should be on the EPA's list N, like Nathan. List N are disinfectants that have proven efficacy against COVID-19. Any disinfectant that you use should be on that list, and you need to make sure that you're following contact time or dwell times, kill times. They're all synonymous with each other. Making sure that those surfaces stay wet for that amount of time, and they vary all the way from, I've heard of a new brand on the market for a 30-second dwell time all the way up to 10 minutes. So it's making sure that you're following those dwell times, making sure you have that wet time. And then also, if you yourselves or you have businesses that you oversee, if you're making dilutions, making sure that those dilutions are as close to manufacturer recommendations as possible. A lot of people think that if you make a stronger dilution that it creates better cleaning, and that's not the case. And in fact, in a lot of cases, it can be detrimental to your cleaning efficacy. And then going back to air filtration, I kind of mentioned this, but making sure you have that minimum of a MER 13 all the way up to a HEPA filter, a P100 filter. And obviously, the more efficient the filter, the more strain that it's going to have on your your fan motors. So that's something to take into consideration as well. Next slide, please. So reactivating the office space. Again, we're looking at, and I'm sorry, Dr. Zotansky, do you want me to take this or do you want that?
Yeah, sure. Either way, you and I have been working together a while, but I can start and then you can chime in where you think. So reactivating the workplace, there are governor's guidance around temperature checks, screening checks of your employees, and you'll see on our website, we use a cutoff of 100 degrees. We just think that's a little simpler and it's a little more conservative than some of the other recommendations, but I think it's simpler than sometimes people to follow for the 100.4. And then are in the cube space there to checkerboard your cubes where possible, and if they are not high enough, to add some type of barrier between the cubes. And also to remind people that our understanding of it is that that wearing a mask at the cube is because it's really an open area. So to ensure that people are wearing masks at the cube. Of course, also virtual if possible. The top right, you're seeing some grab and goes. And then also in higher traffic areas below that, doing that one-way traffic. And then at the bottom right, that consideration around eating, we do think that eating is a higher risk activity because you have your mask off, and when you eat, you're generating particles. So to give special thought around eating areas, break rooms, cafeterias, those types of things. Next slide, please, Andy. And this one is a slide around different suggestions in that cleaning of the high-touch surfaces. That's, if people are using the kiosks where you touch for interacting with your company, to make sure that those are clean, either between customers or at least frequently. And then the maximum occupancy, to put some occupancy limits on rooms, conference rooms, rooms where people gather, so that they know the maximum number of people that should be allowed in that area, using that signage. In the top right, we've worked with some manufacturing firms because a common question is, what can I do when people can't physically distance? There's a lot of talk around face shields right now, and whether or not they're a replacement for masks. We use them in healthcare as an addition to mask. So there's a mask, and also to protect your eyes and that mucous membrane, which is your eyes, from any type of bacteria or viruses entering your body. That way, the face mask, and also the face mask to help that respiratory spread, to kind of contain that respiratory spread. But when you can't physically distance, when you can't maintain that 6 feet and you still have to work together, we'd like people to consider a mask plus. What else can you do beyond the mask? And then we talked about staggering, and then also the bottom right is, of course, very importantly now, encouraging people to stay home when they're sick. One of the best things we can do, of course, is staying home when we're sick. Next slide, please, Andy. And then this is also, you'll see in the content that we have, put this here as a reminder that there are those graphics that you can use in your own organization. And again, some of the things that we have seen and worked with manufacturers, small businesses around what can you do to add when you can't physically distance. So you see, those illustrations of people working closely together, and we've seen some great examples for manufacturing where they build barriers, and instead of on the assembly line where they're right next to each other with no barrier, building barriers and then creating a small pass-through where they can pass the manufacturing product between people. And then again, in that bottom left, decreasing the density in conference rooms where people typically would gather in larger groups. And Jameson, I don't know if you would comment there. We've seen a lot in manufacturing around people leaving the cleaning supplies for employees to clean. Any best practices if they're leaving them for their employees? Not sure, maybe if you're on mute again, but.
Yeah, sorry. So a couple of things that I want to iterate here is some people might think that the physical distancing means that, or I'm sorry, the physical barriers, think that you can remove your mask at that time. And those barriers, as Dr. Zosanti said, are in addition to anything that that you already have in place. So, and especially when you take away distancing, that barrier is in addition to the mask or the face shield. Another option for if there is a limited supply of face shields or goggles, but what we found from people is that the face shields are just more comfortable to wear for longer periods of time.
Thanks. And then next slide, please, Andy. And so this is just a reminder that for me to talk to you about that we have worked with a number of different organizations, businesses, certainly many schools, K through 12, higher ed, really many different situations about how we support safety practices. And what we try to do is reach out to the community, share what we know. We've learned a lot working with many organizations in the community. And on that top left, you see we have our playbooks that we publish, and we put them on our website that we told you earlier. They're free, they're downloadable to the entire community to try to help understand what's out there. There's a lot out there in the media about what to do. There's CDC and ODH and World Health Organization and many professional organizations giving advice, and we're trying to help point people in trusted directions, but also to help simplify the information somewhat and at least categorize it so we can say, do we have these big categories checked off, and then what is beyond that, but really to help simplify and categorize how we think about it. And we certainly have other services because of the demand from the community and the big ask from the community that we do in a more detailed fee-for-service basis around doing a deep dive on people's back to business plans, back to school plans, those types of things to really go in detail and look at their plans and help guide them as they move forward. And many other services that have been asked for by our organization from the community around screening at entryways, those types of things. But really, it's the vast majority of our work has been just trying to share what we know with the community in a way that's free and accessible to the community and make ourselves available as we can, because well before COVID, we have been masking, we have been thinking about the difference between the face shield and the mask, those types of things. We have been cleaning for infectious disease, including viruses, all of those types of things. And so it was really just an attempt to pivot this to share with the community. Unfortunately, there isn't an easy answer and there's no guarantees, but to share with the community some trusted resources and best practices as we can. And also, as things change, to try to be there to help understand the changes with the business community. So I'll stop there if there's any questions, comments.
Hey, Dr. Zosanti, if I could jump in here. As much good information as there is out there, there's also a lot of misinformation, and you want to direct people to reputable sources. So the CDC, the FDA, there's a lot of hype out there about, carbon dioxide retention and a mask causing or increasing your risk for infection, and those things are just not true. So you want to direct people to reputable sources is what I want to say about that.
Yes, and also we've been approached by businesses when they're asking, hey, this vendor approached me and said they could clean my business once and it's COVID free for the year. these types of things that we're trying to help people understand. These are the trusted resources for cleaning. These are the trusted, and that your money is better spent on an EPA approved product rather than a company that approaches you without the evidence to support their claim.
Yeah, that's a great point. I mean, if it sounds like a magic wand, it probably is. There is no magic cure for COVID or something that's more extraordinary than anyone else. So it's one of those things, if it sounds too good to be true, it probably is. There's a lot of products right now, especially that manufacturers are trying to sell that either haven't had proven efficacy and they want you to be their test dummy, or they just don't know if it's, to be honest, if it's going to work or not. So making sure that you're staying with the EPA list in, and doing research on these things. And another thing about hand sanitizer, there's all kind of products right now that have a bunch of different active ingredients, but the only hand sanitizer that is approved by the FDA is alcohol-based hand sanitizers. And that falls in line with WHO, with the CDC, with U.S. Pharmacopeia. There is no proven efficacy for non-alcohol based hand sanitizer. So something to keep in mind, because we've had a ton of vendors try to approach us with copper infused and silver infused. Stay with what we know.
All right, I want to thank, oh, sorry, go ahead, Dr. Zoltansky, were you going to say something else?
No, that's all. Just send it back to you. So thank you.
Okay, great. Thank you guys. We do have some questions. I want to make sure that we get to those so that we can have people's, give people the answers that they're looking for. So in the chat, I have a couple of questions. One is, once recovered, can you get COVID again?
That is $1 million question. I don't think anybody knows the answer to that just yet. So there are some antibody tests out there that show that that our bodies produce a way to fight off COVID potentially again, but nobody knows how long that will last and if that actually in fact is the case. So no one knows.
That's fair. Second question is, if you have tested positive for COVID, what is required before you should enter the workplace again?
So that's a common question. And what we will tell you to do, which is if you don't have this already and you have a business open, to have a relationship with your county department of health. Your county department of health, when someone tests positive, contacts that person, contacts their contacts, and helps guide them with many of those types of questions.
Great, thank you. If a business or a business owner has questions specifically regarding reopening safely in this era, can they reach out directly to you? I know that you have the Healthy Restart on the website, but is there a way for them to reach out to you directly with questions?
Yes, there's on the website, there's a link to contact us directly.
Okay, perfect. And then you guys kind of touched on this at the end. I just had a question because, you know, I do social media for a living, both for the chamber and for my own marketing agency that I own. And so we see a lot of things right now on social media, obviously about COVID and the efficacy of certain things. And then obviously the whole mask debate. And there's so much information out there and so much fake news. So without making this a political question or answer, how do you combat those people that say to you that this is all a conspiracy and, you know, they're taking away our freedom and our civil liberties by making us wear masks? Do you point them to those resources like the CDC that you were talking about? What's the best way to combat that, I guess?
And I think there, you know, is a lot of controversy around it because it's been made political, but for us, it's just medical information. And if you look at hospitals and healthcare, we didn't start this when someone was either elected or not elected. We've been wearing masks for a long time in healthcare for a reason, because it slows the spread of infectious disease. So all we can do is put out there what we see as the trusted medical information, and people can interpret it and take it the way that they like. But
Right.
of course, we recommend as much as possible masking.
Thank you, and thank you for recommending that. I think I don't see any other questions in the chat, so unless anyone wants to raise their hand, I think we're all done with questions. I want to thank you guys for being here and giving us some really important information. I think maybe some people are getting a little bit of COVID fatigue and are sick of hearing about the topic, but unfortunately it's one that remains important and will remain important for some time, for the foreseeable future. So we really want to thank you guys for addressing this for us. Heather, is there anything else you'd like to add?
Just to let everybody know that the email that goes out after this event will have the link to University Hospitals for the Restart Playbooks. So please share that with your employer, with friends, family. I sent the school one to my brother. He's a teacher. So is his wife. So sent that out. So please, send people back here. These are obviously well-tested and trusted ways to restart and reopen. So thank you very much for this. This was wonderful.
Thank you.
Thank you.
Everyone. Have a good day.
You too. Thank you.
Thank you. Bye-bye.
Bye.